Welcome back to our Dan Education series about the heart, health and diving. We're in Chapter 5, Part 5, in which we'll be talking about sudden cardiac arrest. Keep watching. Sudden cardiac arrest, abbreviated SCA, is a stopping or cessation of the heart's beating action, often with little or no warning. It is an acute medical emergency. During the arrest, blood stops circulating to the body's vital organs, of which the brain, the kidneys, and the heart, of course, itself, are the most important. Cut off from oxygen, these organs die within minutes. If the arrest is not quickly corrected, the affected individual will not survive. The causes for SCA include a heart attack or myocardial infarction, heart failure, drowning, coronary artery disease, severe electrolyte abnormalities, drugs, or abnormalities in the heart's electrical conduction system. Cardiomyopathy, which is a weakening of the heart muscle, and an embolism, a clot that is lodged in a major blood vessel. SCA accounts for 450,000 deaths in the United States each year at the moment. So multiply that by a factor of 4 or 5 to have a picture of the rest of the world. 63% of cardiac deaths in Americans that are older than 35 years old are the result of sudden cardiac arrest. The risk of sudden cardiac death in adults increases as much as 6-fold with increasing age, paralleling the rising incidence of ischemic heart disease, which we've spoken about previously. The risk of SCA is also greater in those with structural heart disease. But in 50% of sudden cardiac deaths, the victim has no awareness of having an underlying heart disease. And in 20% of autopsies that are conducted following such deaths, no structural abnormalities are found. Though there is typically little warning before a sudden cardiac arrest, occasionally the individual may experience lightheadedness, difficulty breathing, palpitations, or chest pain. Immediate treatment should be focused on restoring the circulation quickly, using chest compressions or CPR and defibrillation. Following resuscitation, the victim should be transported to a hospital as soon as possible. Subsequent treatment may consist of efforts in eliminating the underlying cause of the arrest through the administration of medication, surgery, or the use of even implanted electrical devices. Preventative strategies include learning to recognize the warning signs of an impending SCA, in case they do occur. Also identifying and eliminating or controlling any risk factors that may affect you, and scheduling regular physical exams, with appropriate testing when it's indicated. So what about the effects on diving? Well, they should be pretty obvious, but divers with any symptoms of cardiovascular disease should be evaluated by a cardiologist and a diving medical specialist or practitioner regarding their considered ongoing participation in diving. In asymptomatic individuals, the risk of SCA may be evaluated using the prediction scales of cardiovascular risk factors such as smoking, high blood pressure, high cholesterol, diabetes, lack of exercise, and being overweight. Just for example, people who smoke have 2.5 times the risk of suffering sudden cardiac death relative to non-smokers. So take care of yourself, and if all things are not in their proper order, or you're concerned about your health, seek medical advice in advance. Don't wait until your heart stops beating. Thank you for watching this episode. Share it with the friends and diving buddies that you may have, because it's an important topic. And of course, subscribe to this channel and continue supporting Dan. Thank you for watching.